Might have gotten them that time, guys. Hello, Facebook. Hello, YouTube. Welcome. Let's see. Today's new post was on what is it like when your water breaks? So I get so many questions about when your water breaks. I kind of have a bunch of posts that are like a lot of minutia about what it's like when your water breaks. So, do any of you guys have questions? I would love to know. Tell me. Um, if you have questions on Facebook or on YouTube, please ask the questions also. Carla just asked, what is an ultrasound at 28? I'm guessing 28 weeks. Yes, Carla just clarified. Weeks 4. Okay, so you'd have an ultrasound for a variety of reasons. Let's see if I can. Look, you guys are both at the same level now. Okay. So at 8 weeks, it really depends. So first off, you want to ask your doctor, which by the way, I have a whole little mini course. It literally takes like 15 minutes and it is so helpful where I talk about how to ask questions with your provider so you can get information like this. Carla, you should totally join me. If you go to my, sorry, I've got to do not disturb that. Sorry about that. If you go to PregNurse, the link in my profile, and go to resources. Under free resources, you'll find my insider tips to labeling like a pro. And one of them is asking questions. And that's so important for things like this. So you're going to ask them why you're having the ultrasound. Most commonly at 28 weeks, it's for growth. It could be something that they just didn't see well enough at the 20-week ultrasound. So find that out. And then you're good to go. So usually, 28 weeks, it really varies. Usually it's probably a level 2 ultrasound where they're just looking at something they didn't see well enough at the 20-week ultrasound. All right. Ack said, I'm dying of nausea. Your username says that. I'm sorry. Tried everything, ginger, Unisom, nausea bands, and everything. Guys, tell us in the comments if you have suffered with nausea, etc. also. Okay. Ack, have you talked with your provider about like a medication like Zofran? I've had friends who ended up doing steroids. Honestly, the problem with it is you get dehydrated and then you like start feeling worse, and then it's just like it spirals out of control. So being dehydrated makes it worse, and then you throw up and then you're more dehydrated. So even going in to get a liter of IV fluid sometimes can help as well. So talk with your provider about other medications to take. Some people say they have luck with the pregnancy pops. I have a post over on the Pregnancy Nurse about nausea lollipops that you might find interesting. And also talked with them about possibly getting some fluids. Facebook, if you got anything, give us actually, if someone could just comment. I have like a new little thing working on Facebook. Facebook, I'm looking at you, and YouTube. So if you guys could just leave a comment that's just like hi, so let me know that I can even see what people are commenting, that would be amazing. Okay. Jemiah says, I'm 18 weeks and having diarrhea. What should I do? Just keep hydrating. The brat diet, bananas, rice, applesauce, toast, just mostly white foods that kind of help to constipate you, don't irritate your bowel. You want to stay away from fats and really heavy proteins. Yeah, but they really don't recommend any medication like Lamotol or what is that? Imodium or really Pepto-Bismol during pregnancy, as far as I know. But you could ask your provider. But if it continues, you may want to get like a parasite check or something like that. How far do you have to be to know the gender of your baby? Jada asked. Usually you don't find out till about 17 weeks, although if you're looking at ultrasound, but there is I can't remember, that test that they do early in pregnancy that I'm completely blanking on, that you can do earlier. Who knows the gender of the baby? Tell us in the comments. Am I able to get my teeth removed in my second trimester? Yes. If you guys have dental issues, and I've seen this a couple times on social media lately where dentists won't see you because you're pregnant, but that's really problematic. So you need to be able to get dental care. If you're not, talk with your OB. They might have somebody that you can work with. Yes. Yes. Oral care is super important during pregnancy because they've found that when it festers, it can get into your bloodstream and be really problematic for both you and baby. Ax said major pregnancy pop aversion after having one. I'm not sure what you're referring to, but I don't like aversions. Should I find a new OB that delivers a higher success rate VBAC versus currently OB and hospital? Is your OB open to it? Do doctors really know their VBAC success rate? I don't think that's something we checked at the hospitals that I worked at. Mostly it's how they're open to it. If he seems really close to it, then you might want to get a second opinion and see where they go. That being said, that being genetics test, you got a genetics test for your gender. That being said, about a VBAC, rolling back, there are some people that really are not good candidates for a VBAC. So a second opinion is always valuable. And I don't know if you guys follow Beach Gem 10. Oh, somebody commented on Facebook. I can see it. Thank you, Crystal. I'll get to your comment. Beach Gem 10. She's a pediatrician who I absolutely love. You guys should 100% follow her. But she's a big believer in getting, and she's like, even for me, I say get a second opinion. She does it all the time, and I was like, genius. Honestly, I feel like doctors are way more into the second opinions. Maybe because they're rich and they don't care about the copay. Just kidding. There you go, Nani. Hopefully that was helpful. What do I do if the hospital is not taking my preeclampsia seriously? Also itching all over me. Abigail, have they checked your bile salts to see if that could be a thing? The hospital really isn't in charge of taking preeclampsia seriously. That would be the provider. So when you feel like something's not being taken seriously, I always ask them, at what point do we act on this, right? What does my blood pressure need to be, etc. So, yeah. Ever seen anyone have shingles during pregnancy? I have not, and I don't know much about that one. So keep in close touch with your provider. I've had cholestasis and liver issues before. Yes. Abigail, are you the one? Yeah. So Abigail, see if they can take your bile salts levels. Is being induced before 40 weeks unsafe? So the ARRIVE trial showed that it was just as safe as waiting. Yeah, I have a whole deep dive into the ARRIVE trial if you buy my Bump to Bassinet bundle with the online prenatal class for couples, where I dive into that trial, what the results really mean. But if I was 39 weeks and super uncomfortable and my hospital would allow it, I don't think I would be against it after reading that study. Tips for plus size pregnancy. Diana, I have a whole post on pullingcurls.com. That is, let's see, plus size. Let me give you the title so that you can see it. Top tips for your plus size pregnancy. So if you go to pullingcurls.com, I have all the tips in there. I am a plus size gal. Great tips for you. Abigail says 201 over 100 is my highest. That seems insane. But if you've only had one of those that high, keep an eye on it. I don't know. That seems too high to me. I don't like that number. See what they say. All right, I'm dipping over to Facebook. Hello, I'm due 4/18, currently 2 centimeters dilated. 75% of my appointment yesterday was low in the birth canal. My doctor said the water bag was bulging. Does that mean labor is near? Fourth baby here. Crystally, it sounds like you're in a good spot. You're due in a couple of days. Your water bag's bulging, so that means like think of like a Ziploc on top of my head with water in it, right? So there's a good chance that it could break just because that's going to apply a lot of pressure to that. But you just never know. I mean, it's your fourth baby and you're due in 2 days. So yes, labor is near. Hang in there, girl. That's a lot, but it sure sounds like it. 75%, 2 centimeters, 75. That doesn't really mean so much, but baby's low and yeah. Magalyn says, I have an induction scheduled for the 23rd. Is Cytotec, breakwaters, Pitocin the normal operation of things? It really depends on what your cervix is, Magalyn. So if you're past 3 centimeters, they're going to just start you on Pitocin. If you're prior to 3 centimeters, we've got a lot of options. So you want to ask your provider and what they normally do. Honestly, every hospital kind of has their own, like, this is what we normally do thing. So ask them. They should know. All right, back to, I don't think I'm going to hit all of these on TikTok, guys. So if you have a question again and I haven't answered, please keep asking it, feel free to. Are preeclampsia and gestational diabetes signs of placenta failure? I just read that on a comment. No. I would just say no. What cough syrup is safe during pregnancy? Ask your provider. I'm 36 weeks, 2 days. Is it normal for my stomach to be so hard? If you so I always felt like my stomach was hard all the time, especially when I was at work as a labor and delivery nurse pregnant. But when I would go home, if I kind of lay in the fetal position, I would notice that it would loosen up. So yeah. I mean, you're just not going to contract all the time. So usually that's like your abs getting stretched over the baby. Serenity asked, let's see, 25 weeks with an anterior placenta, kicks some days and minimal the others. I want to go. So at 25 weeks, you don't have like a pattern of how baby moves, which is why they don't recommend kick counts until closer to the third trimester. Now, if you have a high risk pregnancy, they may tell you to do it earlier, but in general, because the placenta gets in the way or just how the way baby is facing and they're small enough prior to your third trimester, they don't recommend kick counts or really monitoring that for fetal well-being. Talk with your provider if you have questions about that, though. Just because there isn't a pattern, there will be times where baby goes radio silent and you'll be worried, and it's not like a big deal. How long of time period do doctors recommend between pregnancies? Man, we had a talk about that over on my Facebook page, and it varied all over the place. So talk with your provider. Why did I fail my 1 hour glucose but pass the 3 hours with flying colors? Because you didn't have diabetes. You can fail 2 with the 3 hour glucose, and it might have just been the day. Sometimes I'd have patients, this is why I have a post on what to eat before your glucose test. I'd have patients who like drank a cherry Coke and had a shake before they came in for their diabetes test. And you're like, no, that's dumb. So it could have been something that you ate ahead of time because that will affect it. Headed back over to Facebook. I'm diabetic and trying to decide what point to consider it controlled enough to start trying to get pregnant. I also just turned 35, so I don't want to wait so long that it never happens. Sarah, if you're 35, I mean, talk with your provider, but I would probably just give it a whirl right now. That's tricky. But once you're pregnant, it's going to go out of whack either way. So you just need to stay in really close contact with whoever's controlling your diabetes and tell them that you're considering getting pregnant or you're trying, and see what they say. Megalyn said, I'm high risk due to high blood pressure, but haven't had any actual issues with behind during pregnancy. The meds are working great. Doc wants to induce by due date, but I definitely want to go into labor naturally. Do I have to be induced? You guys never have to be induced. And that's one of my huge tips in my insider tips. So if you go to the pregnancy nurse, which is everybody's link in the profile, go scroll down to resources, click on free resources, and I have my insider tips to laboring like a pro, but it really is just like managing your pregnancy like a pro. And I talk about like how you are always making the choice, even though your provider is like, they'll say stupid things like, I'm not going to let you go over 40 weeks, or they're not going to come to your house and pick you up. I can promise you that. So no, you always have the choice. Just say, no, I'm not interested in being induced. My blood pressure, and then listen to them, because like I ignored my doctor for a week. And then the second week she sat down, she laid out all the complications that I had. And I realized that it was probably my best bet and I should just get it done. But yeah, it is always, always, always your choice. And finding a new provider. Megalyn, I can't. Oh, you're due on the 23rd. That's going to be difficult to find a provider. No, I think at this point you just stand your ground. And Megalyn, I would 100%, I don't know what number baby it is, but I would 100% recommend taking my prenatal class, because we're going to go over all the methods that they use to induce you, all how to talk with your provider, all that stuff like that. I'm going to put that in the comments, the link to my prenatal class, because I mean, I give some quality tips on here, but it really just isn't, it's just not the same. Oh, somebody about Stalin. No, I did not. I did not want to show that. How do I like delete it on here? Okay, God bless. Okay. Let's see. I've got some more. Oh, guys, I'm missing on TikTok. I'm skipping. She's having a baby is here. Hello, hello. Did you not follow me before? Do we need to have a talk about that? Do you answer questions about possible pregnancy? I really don't know that much about getting pregnant or staying pregnant. That's just not my area of expertise. So I don't usually answer those types of questions. So I'm pregnant with my fourth, and I've never been more miserable. 13 weeks on Thursday. Allie, first off, congratulations. Hopefully, you're feeling that way. And yes, it completely sucks. I'm so sorry. Emma Grace says, I had a positive test last night, but a negative one this morning and started bleeding a little. Who knows, Emma? You just kind of, it's touch and go there at the beginning. All right. Well, I'm glad you're following me now. She's having a baby. Everybody, she's having a baby. She's in here. She really helps Black maternal health. Huge fan of that. So great work here. I'm innocent. Sure you are. Nobody's innocent. I'm using Zofran and Unisom, but I feel like a shell of a person. Allie, I am so sorry. Oh, you've been pregnant before, though. Did it resolve? So why is it so hard? YouTube. Auto scroll. Nope. Just having a freak out. That's fine. Some people, it does not get easier for each pregnancy. No, but I wondered if she knew when it would get better. Best way to deal with constipation. Does it get better after the first trimester? For some people it does. Are you taking an iron supplement? The best way is really just lots of fiber. And honestly, I feel like fiber varies per person because dried fruit does a lot for me. I know it doesn't do a lot for other people. Another thing I love is Cracklin Oat Bran. I don't know if you guys have that, but it is like a boatload of fiber. So fiber. It's not everybody's favorite. I'm 12 weeks on Thursday. When do I actually get pregnant? That confuses me so much. So you're 10 weeks ago-ish, probably. Usually you get pregnant about 2 weeks into your pregnancy, which is like super confusing, right? That's my guess. Is Unisom melts okay? I do not know, Victoria, if that's the same stuff that's in regular Unisom. Ask your provider. Can you talk to that? It's normal for birth not to get easier with each pregnancy. I think it got worse because I got older, probably, right? I thought I was going to, she's having a baby. I can't bring you on because I'm live also on Facebook and that other platform, Facebook and YouTube. So I can't go live with just you on TikTok, sadly. But each pregnancy, I think it does get worse because you get older. I thought I could surrogate on my first one. I was 24. No, by 34, I was like, please kill me. Please kill me before this baby gets out. So, okay. So Allie, you do have a history. It gets better at 16 weeks. So sometimes it just helps to know that there is an end game because you think, am I going to last all 40 weeks like this? Right. And I'm hoping that you don't, but ask them for meds. You said you're on Zofran. Some people like those preggy pops. I don't know. Again, I didn't also get a lot of nausea either. 33 weeks tomorrow, my first pregnancy. I'm so ready for it to be over. I'm miserable. They're 33 weeks, Ashley. Hang in there, girl. You got time. Come take the online prenatal class for couples. I think you would love it. And it might give you some tips on feeling better. And check out the pregnancy nurse because I have a lot of things for just like fixing hips and stuff like that. Somebody said their girlfriend's pregnant, eat a lot, and then stop eating, so much lost appetite. Yeah, I feel like appetite's all over the place in pregnancy. Oh, your last baby's 1. But there's so many good phases in childhood. Somebody lost their mucus plug 2 days ago. Usually an indicator that baby will probably come in the next week, but not always. I've had people just walk in and be like, I lost my mucus plug. And I'm like, that's amazing. What else brought you here? And they're like, I thought that should bring me in. And I was like, my favorite is when they bring it in a Tupperware. Please don't take your mucus plug to your labor nurse in a Tupperware. Thank you. Please also don't take photos. I will believe you. And I don't want to see it. I actually gagged when I saw my own in the toilet because I am not a mucus fan. 12 weeks pregnant. I have so much pain on my left hip. It is probably ligament pain. So sometimes some light heat Duda can help out. Talk with your provider about what they would recommend. Ligament pain happens in the first trimester and the third most often because your uterus is just like, what the heck? Currently will turn 36 weeks tomorrow. 3 centimeters dilated. Awesome. Doesn't mean anything though. Water has not broken. You still have, REM, have you gotten a prenatal class? Still time to get that done. Risks with a Tolac, talk with your provider. It really varies. Oh my gosh, I'm getting so many questions on the Tickety Talk, and I'm ignoring the Facebooks because, let's see. Can I pump at 39 and 5? Is it safe? Crystal Lee asked. Usually, has anybody tried pumping? I mean, at 39 and 5, what are you going to do? Induce labor? Honestly, so we do a thing in the hospital called contraction stress test, a CST, different than an NST, non-stress test. And we tell you to rub your nipples or use a pump in order to start contractions. And so I've seen people do it, and usually right after you stop pumping, they just stop. So, Crystal, my BFF for breastfeeding is the breastfeeding mama. And so I would check her out. Maybe ask her. She does questionnaires a lot. As far as is it safe? Yes. Is it smart? Is it a great use of your time? I don't know. I don't know what you're trying to do with it. Ellie said 6 weeks left and my midwife hasn't went over the birth plan with me, freaking out. Ellie, are you delivering in a hospital or at home? Like your birth plan or her birth plan? Hard to say. If it's your birth plan, it's always, you're going to have to kind of bring it up because a lot of providers aren't going to be like, so do you have a birth plan? Because they're just like trying to get through patients. By the way, guys, I do have a free birth plan, like little mini class and stuff that you guys can come get under. So scroll to the pregnancy nurse. If you're like, I don't know what that is, just Google the pregnancy nurse. If you Google pregnancy nurse, I will not come up. But the pregnancy nurse, scroll down to resources, click free resources, and I have a whole birth plan thing that you can click on and sign up for. So she's having a baby, did try to Tolac, and she ended up having a VBAC. But I know there's a lot of people who offer classes on like how to VBAC, and I love me a VBAC, but so much of it depends on why you had your previous C-section, what your uterus currently looks like. Because if you've had a scar that went up and down, I don't want to see you in labor at all. And so talking with your provider about what we learned about your body and what happened to your body on the last one is so important. A VBAC, in case people don't know, is a vaginal birth after cesarean, and a TOLAC is what happens when you're trying what is the T for? All of a sudden, trial of labor after cesarean. I'm having a stroke, guys. I'm not. Look, smiled both sides. Yes, so miserable in the last few weeks. I'm here for that. Shay said she just found out she's pregnant again after 20 years, and I'm so sick. I don't remember it being so bad. Oh, Shay, you are 20 years older, girl. You got this. I have to say, I've seen a lot of moms who had like their 21-year-old is in the labor room with them, and your body still remembers. That's the good news right there. Exciting, Shay. Hopefully you're excited about it or adjusting to it. Jojo, I want to go unmedicated natural. Most I want to use is the gas. Make sure that your hospital uses the gas. Not every hospital does. So that's something to check on. What could be the reason for having shortness of breath while lying down? I'm 6 months. It could just be that baby is moving up into your lung space. There is a mild amount of shortness of breath that's okay, but it shouldn't be crazy. And if honestly, if you're having shortness of breath, I would bring it up with your provider just so they can listen to your lungs or your appointment and make sure things sound okay. Because you could have, very rare, like a blood clot in your lung. That can happen. So you want to be aware. Okay, I'm like 28 messages behind, so I'm just gonna have to scroll to the bottom, and I'm really sorry if I missed anybody. I found out that I have the MTHFR mutation, and they put me on baby aspirin after 3 miscarriages. I do not know too much about that mutation other than it brandished about a lot on the interwebs, with some OBs saying it's not a big deal. But I do know that a lot of the OBs that I trust are using aspirin all the time. So I'm a fan of it during pregnancy. There do not seem to be many like negatives, which is crazy town. And because when I started labor and delivery, aspirin was like, no, never, 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 never. Why can't we learn more about what's good for pregnant moms? Why did it take 20 years? Is it safe for my pregnant girlfriend to work a lot? She's a CNA. As long as she feels comfortable, she's not hurting too much. Usually it is. I've worked with lots of pregnant CNAs and they are amazing. Okay, moving over to Facebook. Ellie said she's 6 weeks out and the midwife hasn't gone over the birth plan with me. So Ellie, first thing is you bring it up at your next appointment, go over the things. I'm guessing. Oh, and she's on amoxicillin for a chest infection. So she may have just been focused on that. Bring it up at your appointment. She's probably just going to scan it, see if anything like strikes her out of the ordinary. And then she's just aware, right? Then you're going to bring it to labor and delivery, or she may ask for a copy. It might go over with your prenatal records, stuff like that. So Ellie, come join me in the online prenatal class for couples though. So important to get prepared for all the different things about birth. And you're delivering with a midwife, which I love. Midwife hospital midwife birth. Was anyone here at the beginning when I had to fly? It came back. Megalyn asked, do people ever try to orgasm during labor to help with pain, or is that weird? It helps period pain, so maybe it could help with labor pain. I have seen it. If you're gonna try and do it, it's better to let your nurse know and maybe try it when they're not in the room, just because it's super awkward. Although we do all awkward things. But I haven't seen, people have tried, and some people will say that it like helps, like what they're doing down there. I don't know. Fourth pregnancy, is it possible to show early? I'm 10 weeks. It can, especially on your fourth. Yeah. When is class? This is my partner's first child. Hey, Shay. It is available 24/7 on demand whenever you're available. You can find it online, prenatalclass.com, or over at the pregnancy nurse. You'll see it right away. Yeah. Does having a postpartum PPH, postpartum hemorrhage, make you more likely to have another? It can. It is definitely something you want to tell your provider, because a lot of times if they previously had one, we might have some blood on standby, or just watch out for it more. So definitely talk with your provider about it. It can happen, but a lot of times we'll be like, everything's on standby and nothing happens. It was just something based on the previous pregnancy, maybe how the placenta inserted or how much Pitocin you had or stuff like that. Ellie said, I was brought in for fetal and growth scan as my chart wasn't adding up correctly. Wee man was bigger at 30 weeks than at 33 weeks, but being brought back in again on the 24th. Yeah. So a lot of times with ultrasounds, they just want to see that baby is growing on that curve, right? They're continuing to grow. And after you have your baby, you're still going to see the growth curve as your baby grows. So it's just kind of comparing them, and you want to see that they're on the curve, right? If they're on this and then all of a sudden they drop off and they're not growing at all, that's super problematic. So same thing for ultrasounds. Shay said, how do I go about keep my placenta? I don't want the hospital to take it. Just tell them you don't want it. Some hospitals require that it's removed from the premises within so many hours, just because it is bodily tissue. We don't want it like stinking up the rooms or whatever. One of the hospitals I worked at, we required you to sign that you understood it was medical waste and should be taken care of in a medical wasty way. Does taking aspirin during pregnancy mean you can only deliver via C-section? Absolutely not. Nope. I've heard some people's doctors are saying to stop like 38 weeks or something, and some aren't. So I'm not really sure what it said due to bleeding more. They haven't found that with just a baby aspirin. When is the next ultrasound? When you're 36 weeks and 2 days. Aubrey Mora, there is not a traditional ultrasound or like a scheduled ultrasound that late in pregnancy. It would be for a reason if you're having it in your last month of pregnancy. I was prescribed finasteride today for my PCOS. Do you know anything about it? I do not. Sorry. Ellie, you're welcome. So let's talk really quick about the online prenatal class for couples. You guys can keep asking questions in the comments. It is my birth class that I created in 2016. Of course, it's been edited 6,000 times since then. I'm just constantly going through it and editing the video and putting new resources as I find them and articles that I write. It is created for couples to be able to do it together, and you can actually do it with your partner. That's what it's designed to do. And the meat of it is designed to be done in just 3 hours. Now, if you want to get more, we actually have a part on nutrition. We have one on breastfeeding, baby sleep, the Arrive trial, which we talked about before, making the choice to be induced. There's a whole partner tips video where I talk about that in there. I make it the best price birth class I can find online. And it really just gets you just what you need. So you can find it at onlineprenatalclass.com or go to the Pregnancy Nurse, which is my link in my profile. Scroll down, you'll see Get Prepared with Me, and you can go to the page and check it out. If you guys ever have questions, ask me on my videos. I would love to answer. I know there's a lot to pay for during pregnancy, but I really try and make it affordable for you guys so that you can get it and enjoy it. Crystalline said, that's amazing. I need this. I would love to have you in there. That would be awesome. Any natural way to help my body start the miscarriage? I don't know anything about that, but I am so sorry. Have they talked about medications you could take? Talk with your provider. See what they say. What is good to take for constipation? Currently 10 weeks pregnant. Fiber, just buckets of fiber. So I have a nutritionist that I follow that helps in the prenatal class. Her site is Feed Your Zest. That's what it is on Facebook, but if you look at her on Instagram, I'm trying to look up her name. It's like fertility.prenatal.dietitian, and she's great on giving ideas for fiber, eating well during pregnancy. I would totally recommend doing that. Yes, I would love it if you guys check out the prenatal class. If you look at it while you're on here, feel free to ask me the questions on here. We're trying to concede now. I do wish we would have done a class with my first. Yes, I hear that a lot. People end up regretting that they weren't as prepared as they wish they would on the first. Yeah, Fatima, I'm so sorry. What exercises help the baby to flip head down? So I recommend Spinning Babies, going there, looking at the exercises that are on there. I'm not going to go into all of theirs because they have great like pictures and stuff. Just Google Spinning Babies. Chiropractor version. But also, if you do a version, ask your provider if they're any good at it, because some of them are not. Crystalline, does the class teach about partner support and positioning? It does. We have a whole partner video in the Bump to Bassinet bundle, and we have labor movement cards in the Bump to Bassinet bundle that talk about all those different kinds of things. That being said, your best advocate is your nurse about positioning, because sometimes as babies' heads in the birth canal, I'm like, let's have you move this way. And I would have patients who were like, I'm not going to move that way. I don't want to sit like that or whatever. So asking your nurse what they think would be best for you to stand up after they've checked you can be really helpful in helping baby to spin the way that would help them out. 32 weeks being told I need to start NST 21 weeks solely based on my BMI. Is this normal? I believe that it is, but keep asking questions. You don't have to do them. NSTs 2 times a week is so painful. Ask if you would do them once a week. Also, huge fan of kick counts. So Nadia looks like she thinks she might be pregnant. Again, not my best area. Do you recommend 1 a day advanced prenatal? Follow fertility, that nutritionist that I just recommended. I would 100% recommend following them. Madison has been on Clomid for 6 months, still no pregnancy. I'm so sorry, Madison. We tried with our last for about 3 years, so I definitely feel for you. Mel, what are some early pregnancy symptoms people might have missed before missed period? Honestly, I don't think there really are that many. Swollen breasts. I got nosebleeds, and I smelled like I could smell everything my husband had ever been around. So Crystalline says, I want my husband to be able to know what to do and help with pain. We did lots of swaying. Yes, lots of swaying. Can you tag the nutritionist, please? Can I tag her on here? I don't even know how to do that. Comment. I'm going to give it a try. Okay, I'm looking it up. Is she on TikTok? I'll give it a fertility.prenatal. Okay. I hope that's a person. Oh, yeah. My husband, I was like, please go shower. No, go shower now. Okay, I'm switching over to Facebook comments. Ooh, I do not have a ton more time left with you guys. 10 more minutes. At my growth scan, the baby boy was measuring in the 90th percentile, but head and tummy were measuring in the 97th percentile. They didn't seem worried about it, but I'm freaking out. No, I mean, the measurements for that are so different. I wouldn't freak out about it. Can the mother or baby feel when the umbilical cord is cut? No. I've never noticed baby notice it at all, because sometimes we like fix the cord after they get in the warmer and we'll cut it then. No, they're just like cool as a cucumber. Hi, I'm 6 weeks and spotting. Yeah, spotting's never awesome early in pregnancy, but it could be implantation bleeding. So keep an eye on it. Talk with your provider if you have more questions. Is it bad that I'm 6 months and haven't been taking a prenatal? I mean, you cannot redo the past, unfortunately, and many things that I wish I could redo the past. But get one. There's prenatal like water additives, there's prenatal gummies. Get a prenatal. It's going to be better for you. I cannot tell you how many of my friends have bad teeth, bad bones, other issues because the baby will take from you what they need and will leave you with nothing, because that's how babies are. So take a prenatal. And you're going to want to continue. This is a news flash for a lot of you guys. You're going to want to continue taking that prenatal after you have the baby. So while you're breastfeeding and stuff like that. Migraines in the first trimester, talk with your provider. Yeah. Best remedies for morning sickness. Man, we're asking that a lot. Zofran, ask your provider what they recommend. If the ones over the counter aren't working, ask for like a Zofran or a Phenergan. Some people like the pregnancy lollipops. And sometimes it helps to hydrate to like stop the cycle and then start again. Dizziness in the third trimester, make sure that you're drinking. Tell your provider because they should check on that. Check your blood pressure and stuff. How long after having a baby do you continue taking a prenatal? So as long as you're breastfeeding, I usually recommend it for about 6 months if you're not breastfeeding, just to like make sure that you've gotten all those vitamins restocked. I found a liquid prenatal. It's been a game changer. Which kind are you taking, Crystalline? I've got to say that I'm disgusted by how poorly the prenatal vitamins out there are. Yeah. So look for one from a great company, because folic acid is important, or folate, whatever you're going to take. Don't look at me on that one, but yeah. All right. I'm caught up-ish on questions. How's everybody's feeling? Give me an emoji on how you're doing in your pregnancy, because I got to say, postpartum, do you recommend a postnatal or a prenatal? I usually just recommend keeping the prenatal going. Pretty girl, I think that's a smile. I don't know about specific prenatal vitamins, but fertility.prenatal dietitian has a little thing you can buy where she like goes over the most common ones and says which ones are the best for which different things. She's also been talking a lot about choline in pregnancy, which can be found in eggs, and I've just been fascinated by it. So follow her, huge fan of hers. Let's see. I just want to say you guys are doing a great job, because pregnancy really sucks. And it's hard. And I want to say you guys are doing a good job. And I'm really proud of you. Crystalline said liquid health prenatal plus one liquid from Amazon. The part 30 said all the things you need. That's awesome. Yeah, a lot of people like to get it in their water. A asked, how bad does the pre-epidural needle hurt? Can you compare it to anything? What about the epidural pains? I'm not sure exactly what you mean by the pre-epidural needle. So they take like an insulin syringe, super small, and they compare it to a bee sting, which I think most people would say, yeah. And then they use the regular epidural needle, and all you feel then is pressure. In fact, I feel like they were just pushing on me kind of hard with their pen. Nothing felt sharp, but it did feel like pressure. Yeah. And when you get it, when you are in hard and heavy contractions, usually a lot of people just don't even notice at all, because the contractions are so much worse. So hopefully that helps. In the online prenatal class for couples, I actually do an epidural with a Raggedy Ann doll. I show you how you're going to position yourself. I show you what's going to go on so that you know exactly what's going to go on. And people find that video super, super helpful, because it's like I use a tissue. I mean, there are some things that I use that are more normal, like I do use a needle, but I'm going to show you what's going to go on, because a lot of people, like, we clean your back off, and a lot of people get freaked out at that because it's cold water or cold soap, and they are like, oh, what's going on, right? So if you just know what's going is awesome. I would recommend the fertility.prenatal.dietitian, or you can find her at feedyourzest.com. She has a prenatal vitamin supplement thing that I would totally recommend. Oh, I'm supposed to go to a church thing here in just a few minutes. Okay, sorry guys. Best way to induce labor naturally. This is a great question. I have no idea. It's an excellent question though. I just don't. The best way to induce labor is to take the medications because the other ones just aren't proven. Dandelion roots safe to take while trying to conceive. I have no idea. Somebody asked about blood normal for the first trimester. Some bleeding can be normal in your first trimester, but you want to bring it to your provider's attention. 25 weeks, anterior placenta, some days feeling lots of movement, other days next to none, only feeling when laying down, I'm guessing is how it finished. They don't recommend doing kick counts until your third trimester because there is no discernible pattern of baby's movement until about 28 weeks. Now, if you're before that and you're super high risk, they may recommend that you do them, but baby can be like hiding behind the placenta. They're so small that they can be in positions where you won't feel baby move, unlike how they will be when you're 28 weeks. So at 25 weeks, there isn't really a discernible pattern, but if you're concerned, you can always call your provider. It's just harder to tell, like, if something's really wrong. After 28 weeks, kick counts are important because fetal movement is your best indicator of fetal well-being, and there should be some sort of a pattern to the movement. Huge fan of kick counts, which, by the way, you can find, go to Pregnancy Nurse, pregnurse.com. Scroll down to resources, click on free resources, and I have a kick count cheat sheet that tells you how to do kick counts, and it has some of the best resources to do kick counts because I think they are so important. Studies show that when kick counts are done effectively, it decreases the percentage of stillborn births by 25%. That's 1 out of 4, guys. So huge fan of kick counts, but you have to do them kind of like daily. Will they put you to sleep voluntarily? My last spinal for a C-section didn't work, so they had to. That's super rare, Becca. I would hope that that doesn't happen again this time. If you're pregnant again, I'm not really sure. But it sucks. I much prefer the spinal, and they prefer to do the spinal. So it could have been the doctor, it could have been the day. Hopefully, I have had patients who had to have be put to sleep on one C-section, and then they were able to get a spinal in the second. Some anesthesiologists are just better. Shh, our secret. 36 weeks, baby, you're measuring 76 percentile. What does that mean? Is it bad or good? Jaylee, go to pregnurse.com, type in growth ultrasounds. I have a whole article on what growth ultrasounds are for and what they mean. And I think you'll find that really helpful. Are you guys talking about if boys or girls, if you have morning sickness more? I have no idea. I had my worst with a girl, so there you go. But I also was much older, and yeah. 37 weeks, today 1.5 centimeters. What can I do to dilate more? Just enjoy your life. Everybody's like, what can I do to get it speeded on? And I get it. You're miserable. It's like the worst ever. There really just isn't anything you can do. Talk with your provider about that. They'll allow you to do an elective induction at 39 weeks. That's my best tip. 20-week scan looked good, but I have an off-center cord placement. Doctor said not to worry. I am. Yeah. It wouldn't be unusual. The only problem is if it's like way off to the side. So I don't know if they'll take another look. As the placenta grows, things could change. So keep an eye on it. If it really was a problem, they would want to look at it again. And they will, like a velaminous cord insertion and stuff like that. So we were talking about the epidural numbing medication. Yes, so that just feels like a bee sting. It is a very small needle. How bad does a spinal? I don't know if you're talking about the epidural or the spinal. To us, they feel exactly the same. To anesthesia, it's a little bit different, and the medications that they use are a little bit different. I didn't think any of them. I had three labor epidurals, and I actually had a second one for tailbone pain, which didn't work. Don't look at me for help on that, but I don't think they're horrible. Compared to labor pain, I was ready to get it. Marginal cord insertion, said they'll start for, yeah, so very normal. Just keep an eye on it. How long before my glucose test can I eat? My appointment is 8 a.m. Is it okay to eat at 6? It depends on your clinic. If they want to take a fasting test, they'll want you to be fasting. If not, it's fine to eat. And I would always recommend just eating like eggs, like something super proteiny. Proteiny. Can a couple drops of blood be implantation bleeding? It can also be a problem. It's hard to say. But if it's just a little bit, my hope is it's implantation bleeding, if that's what you're hoping to. What, you guys, everybody wants to speed up their labor. I got nothing for you. Kayla says, why is my baby always face down on ultrasound? Just how they're located, right? Best tip to prep for no epidural. So Sarah, I'm the online prenatal class for couples. I have a natural pain management module that I think you would be really interested in. We talk about ways to manage the pain, but one of the best ways to do it is to stay at home as long as you can. Being in the hospital just makes it harder. So talk with your provider if you're wanting to do that, and see if you can, stay in close touch with them while you're at home. I think that can be really helpful if, you can check in with your provider every couple of hours and they can be like, because honestly, over the phone, I can tell if you're ready to come to the hospital or not. And I'm guessing your provider can too. But I, of course, can't say anything because #liability. 12 weeks pregnant, I just got slightly low creatinine and BUN results. Should I be worried? No, I don't think so. Sarah said she'll look into my class. I am not in Canada, but I've had lots of people, Sarah, from Canada take the class and say it was very effective. I've also had people from the UK and Australia take the class and say it was super helpful. So, yeah, 6 pounds small for delivery. Usually average babies of like 7.5 or so. Somebody tested positive for gestational diabetes, so it'll just change how you eat. They may encourage you to get on medications, and they may encourage you to get induced. Just depends on how things go. Although I've seen a lot of people with gestational diabetes going well up until like 39 weeks. So huzzah for that. Angel says, I'm 35 weeks, 3 days. I just found out I'm 1 centimeter, 50% of face. She's head down and loaded. Mucus plug fell last week. Thrust 3 days. I've been going nuts. I think I'm having Braxton's contraction, but dang. Yes, it's the worst. It's just the worst. You're still 35 weeks though, so we would love to see baby stay in another couple weeks. We want to aim for at least 37 if we can. 1 centimeter, not anything to write home about. Just try. My best advice, we've had so many of you guys ask. I mean, I have a little thing that's like how to go into labor. That's included with my Bump to Bassinet bundle. So if you're buying the prenatal class, buy the bundle. There is a little booklet in there on my best tips on how to go into labor. We talk about sex and nipple stim, things like that. But my best tip is just to try and enjoy your life as it is. That means relaxing more, possibly working less, things like that. That's really all you have control over, because there really isn't much you can do to make your body go into labor. Yes, I'm reading The Untethered Life. Has anybody, or Untethered Soul? I'm reading that right now. Has anybody read it? And I'm just realizing that is like my whole life. I feel like it's driving knives into my heart because I'm like, I want to be able to control things, but I can't. Sarah said, got it though. Thanks for time. I'll look at the classes. Bye-bye. Yes. Come to join me in the online prenatal class for couples. We have awesome tips like all of that I mentioned, all in that class. It's my best stuff. Brooke said, second trimester tips. Man, girl, you are at the sweet spot of pregnancy. Enjoy it. And this is the time to like start getting prepared. Grab that prenatal class. Look at the things you want to start doing before. Make that to-do list. Talk with your partner about what you want them to be doing so that they're not caught off guard. That's what I recommend. 12. I don't know. I don't know that much about pregnancy tests or getting pregnant. 11 weeks that I accidentally drank spoiled juice. Should I be worried? I mean, did you drink a ton of it? I would kind of guess not. Probably not. Talk with your provider though. Been trying for years, 3 miscarriages. Any tips? Kennedy, have you seen a provider? That's my best tip. I'm sorry. That really stinks though. Let's see. I think I have one more that I'm going to ask. Oh, Angel said it's been a long time since she's had a baby. She is an 18-year-old and now we are with our baby girl. That's so exciting, Angel. But it just is horrible, right? I had my first baby at 24 and my second one at 33. And by then I was just like, I'm done. Flag me out. I'm done. I honestly think that having a baby physically at 16 is like maybe the best. Those girls just handle it so good. And you look back in the pioneer ages, that's when they had babies. And I'm like, should that be when we have babies? Except we're just not ready to raise them. I don't know. Anxiety attacks. Impact on baby in second trimester. I mean, if you're having it frequently, definitely talk with your provider. I would small bouts of anxiety are okay for baby, but if you have long-term anxiety, it's not great for baby, the studies show. Crystal says she has 5 under 7 and she's due in July. She started at 26. Crystal, is it better? Was it better when you were younger? Krista says, same. I was 22 with my oldest. I'm 30 with our fourth, and this one is much harder. My body is old. Right? I don't know that I've ever felt older, including now when I'm 47, than when I was 34 and 12 days over. I'm too old for this. Amen, Crystal. Honestly, when people are like 45 getting pregnant, I'm just like, how do you do that? I don't know. I mean, but I was still working as a nurse, so I had all that. Little kids, did not have a nanny, all that stuff. Angel says she had gastric bypass in 2020. I have to take my blood sugar 4 times daily because I can't do the sugar drink. They're showing that is a viable alternative, but they haven't tested it, which is dumb. I don't know why they haven't tested it. The end. When should I start sleeping on side? What week? Usually they said about 20 weeks, although there was a study that showed it didn't really matter. So talk with your provider about you and your specific needs. My daughter has a subchorionic hematoma for the past 8 weeks, still getting larger. I'm so sorry, Kimber. That's super difficult. I'm sorry. Zafreen said, trying to conceive our first soon. Do you have any calming words for people with factor V blood clotting disorders? I mean, you can only control what you can control. That's like my biggest thing. All right, I think I need to end this because I have to go pick up a friend for a church thing. But 2 things. If you guys want a free class, come join me. Go to Pregnurse resources, free resources, insider tips. I have a free class that goes over my best 5 tips for being in labor and managing pregnancy and labor and all that kind of stuff. Second tip, if you really want all the juicy details, come join me in the online prenatal class for couples. You can find it at onlineprenatalclass.com or at Pregnurse. You'll see the button right up there. I would love it if you come join me because I think it is so important that people get prepared for birth. If you're feeling anxious, I've actually studied the class, and the participants in the class, they felt 54% less anxious after they took the class and 64% more prepared about what they were going to face in the delivery room. So I really want you guys to come in there. It does have a money back guarantee, and it is one of the best price birth classes on the internet. So come in there, join me. If you hate it, email me. You got 14 days to check it, take a look, and decide if it's right for you, because I really want you guys to get prepared. So, thanks for joining me. Cher had a 20-week postpartum. Can I ask my question still? I don't know. I mean, you can ask it, but you got to ask it fast. I'm headed out. Anyway, thank you guys so much for joining me. I love seeing you guys on social media, and I love being here with you guys and helping you guys out. Sadly, I do not know much about getting pregnant. It took me 3 years to get pregnant with my last one, and I obviously didn't have any amazing tips then. So anyway, thanks for joining me. Thanks for all the likes. I sure appreciate you guys. I hope you'll follow me, comment on my videos, let me know what you think of what I'm doing, and we will see you around the internet. And now